Hello everyone, welcome to MSK Ultrasound Shorts. In today's video, we are going to discuss a case of twisting ankle injury. Ankle injuries are quite common in day-to-day practice, and majority of these injuries involve soft tissues, that is periarticular ligaments and sometimes tendons. While X-rays can detect fractures and other bony abnormalities, they provide little or no information about these soft tissue injuries. In this video, we are going to discuss how high-resolution ultrasound can provide exquisite details of various components of ankle injuries. This was a 27-year-old, otherwise healthy young man who presented with history of twisting injury to right ankle while getting down from the stairs about 7 to 8 months back. There was no evidence of fracture on prior radiographs. He was managed conservatively. However, he presented with persistent pain, tenderness and swelling along the medial aspect of right ankle, which was aggravated by physical activity and long standing. On examination, there was some mild swelling, tenderness along the medial aspect of ankle as well as pes planus and heel valgus deformity. He visited many orthopedic surgeons. Finally, MRI ankle was advised, which revealed accessory navicular bone with edema, query due to stress or overload. These are his current radiographs, which demonstrate the heel valgus deformity. There is presence of accessory navicular bone lying posterior to the navicular. Lateral radiographs show some small osseous fragment lying on the dorsal aspect of talar head. So this patient was referred to me to evaluate the medial compartment structures. These are the high-resolution ultrasound images of the medial compartment. We can see the three tendons, tibialis posterior, flexor digitorum longus and flexor hallucis longus. Sorry for this some anisotropy in this region, but otherwise this tendons looked pretty normal. This is the longitudinal view of tibialis posterior. We can see the accessory navicular bone lying within the distal portion of tibialis posterior tendon. Ultrasound explicitly demonstrated the accessory navicular. It was about 12 millimeters in size, and there was pseudo-articulation between the native navicular bone and accessory bone. So this is the tibialis posterior tendon, nice fibrillary echo pattern. Coming to the medial compartment ligaments, this is the tibiotalar or deep deltoid ligament, which looked pretty normal except for some minimal edema within. The tibiocalcaneal ligament attaching to the sustentaculum tali also looked intact. Tibionavicular ligament was also intact. Tibiospring ligament showed some irregularity and mild edema. Moving further, these are the images along the medialmost part of the ankle. What we can see is there is this thickened edematous hypoechoic structure which was lying deep to the tibialis posterior tendon. This was the thickened superomedial component of calcaneonavicular ligament. This is tibialis posterior tendon, the thickened superomedial calcaneonavicular ligament. Now, in addition to the tibialis posterior tendon, calcaneonavicular or spring ligament is an important stabilizer of the medial arch of foot. So the superomedial calcaneonavicular ligament was significantly thickened hypoechoic, also heterogeneous, suggestive of moderate grade, at least grade 2 sprain. So this explains why the patient had pes planus deformity. Other structures, anterior compartment, tendons, anterior recess of tibiotalar joint was normal. Moving further, this was the around 5 millimeter sized fragmented osseous structure which was seen lying on the dorsal aspect of talar head, which corresponds to the osseous structure seen on lateral radiograph. Anterior talofibular ligament, calcaneofibular ligament were intact. This is the dorsal calcaneocuboid ligament, which looks slightly thickened, maybe grade 1 or grade 2 sprain, and there was a small osseous fragment within. Probably there is some partial avulsion. Right tendo-Achilles looked pretty fine, intact. Peroneus longus and peroneus brevis tendons were mildly thickened, and there was minimal tenosynovitis. That could be because of the altered biomechanics. So these are the composite images, and the report revealed an accessory navicular bone within the distal tibialis posterior tendon gist type 2, diffusely thickened hypoechoic edematous superomedial calcaneonavicular, that is spring ligament, with heterogeneous echo texture, likely represents high-grade sprain injury that was mild grade 1 state of tibiospring ligament, minimal tibialis posterior tenosynovitis, a comminuted osseous fragment overlying the dorsal aspect of talar head, which could represent either osteochondral injury or dorsal talonavicular ligament avulsion, mild talonavicular joint synovitis, a tiny 1.8 mm size osseous structure within dorsal calcaneocuboid ligament, and mild peroneus longus and peroneus brevis tendinitis with tenosynovitis. So overall, high-resolution ultrasound can provide various details of the soft tissue injuries, as well as it provides details about the cortex, and if there are any small fractures, small avulsions, that can also be very nicely picked up on ultrasound. Thank you.